Hello, everyone. My name is Sonia Habel, and I'm the Workforce Specialist at the Philadelphia Department of Public Health, and I have the pleasure of presenting to you the Philadelphia MRC 2025 orientation. Before we dive into things, at the completion of this orientation, you will understand the MRC's mission, our history and origin, who we are made up of, who we work with, the eligibility criteria on how to become a volunteer, the benefits of volunteering, volunteer deployments and what those are going to look like, including the scope of practice, data collection and reporting, a snapshot of our year thus far. And as always, if you have any questions or concerns, please refer to the contact and communication avenues listed at the end of this PowerPoint. The Medical Reserve Corps is a national network of volunteers who are organized locally to support the health and safety of communities. The Philadelphia MRC is regularly deployed to support a variety of responses and events in the city, such as large-scale events, emergent responses, and other public health-related activities. Our unit is one of about 800 community-based MRC units across the nation. Nearly 300,000 volunteers in the United States dedicate their time to the MRC. There are units as far as Hawaii, Samoa, and Guam, so wherever you go, you will always have access to an MRC unit full of volunteer opportunities where your service is valued. The need for the MRC became apparent after the attack on the Twin Towers, when medical and public health professionals, eager to volunteer in support of emergency relief activities, found that there was no organized approach to channel their efforts. As a result, the MRC was established to provide a way to recruit, train, and activate medical and public health professionals and other volunteers to support and respond to community health needs during disasters and other public health emergencies. The City of Philadelphia also recognized this need and created its unit in 2005 to respond to emergency disasters and large-scale events. In the years after its creation, the Philadelphia MRC was deployed in March of 2020 to support the COVID-19 efforts. We definitely had an influx of volunteer registrations during that time due to the various deployment opportunities being offered, such as community canvassing, vaccine clinics, testing kit distribution, and drive-through testing. Additionally, in 2021, MRC volunteers were rapidly mobilized and deployed within 48 hours to the Philadelphia International Airport to assist displaced Afghans. MRC volunteers served for 14 consecutive days, providing interpretation, line staffing, screening services, and triage support to over 27,000 Afghan evacuees seeking asylum. Overall, the MRC is an organization that is needed and often utilized by various stakeholders in the city. And we are so happy to celebrate our 20th year of service this year in 2025. Briefly touching further on MRC demographics, there are about 5,000 volunteers in the Philadelphia area with various professional backgrounds and expertise. A majority of our volunteers are made up of clinical personnel, and following that, a chunk of our volunteers are non-clinical volunteers, but work in the public health field. Finally, many of our volunteers are listed as non-clinical and non-public health professionals. So no matter if you're a teacher, dancer, geologist, or physician, anyone who has an interest in helping during a volunteer event is welcome. Through your volunteerism, we've successfully been able to supplement city workforce personnel, and as a result, save the city over $200,000 in economic value. And the work you've done and continue to do never goes unnoticed, and it is always greatly appreciated. Additionally, the work that we do would not be possible without our various stakeholders and organizations within the city. Key partners such as the Office of Emergency Management, Philadelphia Fire Department, and the Philadelphia Police Department help us do our work in an effective and an efficient manner. OEM often assists in the transportation of logistical materials and supplies to and from deployment sites. We also have cultivated a strong relationship with the Philadelphia Fire Department, and we tend to work alongside them in their medical tents at any large-scale special events. Lastly, we have a great relationship with the Philadelphia Police Department, especially during our first responder flu clinics, which is a great opportunity for clinical and non-clinical volunteers to practice skills in preparation for possible scenarios, such as inoculating first responders or other large-scale populations. On a more important note, let's get into eligibility criteria for each MRC volunteer. All MRC volunteers must be 18 years or older. They also must reside near or in Philadelphia. This definitely includes temporary residents such as students, but it's mainly due to the nature of responding to an emergency. We definitely want to make sure that all of our volunteers are able to readily respond and access deployment locations in a timely manner. So moving into next steps, potential volunteers must be registered on ServPA, or the State Registration Emergency Communication System, which we will soon be transitioning to Juvari. No need to worry if you have an account already created, that will also be transferred over. But essentially, it is just how we communicate to our volunteers about deployment opportunities. It is also how we conduct our criminal background checks before members can be approved. We do this by utilizing the information provided in volunteer profiles, and it is really important to note that members must have their name, date of birth, and contact information before we can move forward with this process. Okay, we are going to pivot a bit and get into telling you some of the perks of being an MRC volunteer. The first being gaining the opportunity to build and expand your skill set while out in the field. You'll gain deployment experience that you can list on your resume or log as clinical hours if you are a clinical or medical student. We can definitely verify those for you. Next, we offer free certifications such as Stop the Bleed trainings, continued education credits for licensed physicians, nurses, pharmacists, or EMTs. These events, along with deployments, are also wonderful ways to network and meet like-minded individuals with shared interests. If you tend to volunteer frequently, you'll definitely start to see some familiar faces, and some of our volunteers even go on to make meaningful connections. So continuing along, we also think the best way to thank you, our volunteers, is through giveaways. We offer certain preparedness materials, MRC branded apparel to use during deployments, and emergency grab-and-go kits, and we hope to offer more of these giveaways in the future. Finally, like I kind of touched on before, we offer virtual and in-person trainings where there are opportunities to continue to expand your education and build on that knowledge you already have, or if you are just looking to strengthen this, it might be a great option for you to join any of these. Again, these trainings are open to both clinical and non-clinical volunteers. So what does the deployment process look like? As I stated earlier, all volunteers are required to register in ServPA and select the Philadelphia MRC as their organization. If needed, there are instructions on how to register and what information is required of you, and that can be sent out through email. If you, for whatever reason, encounter any roadblocks, I would be more than happy to help you move through that. If you would just refer to the email at the end of the slides, I can answer any questions you may have. Next, once you have been registered and your account is approved, you will be eligible to receive deployment opportunities that you can sign up for and that we regularly disseminate through email. So this could be from our MRC inbox or from ServPA, but it will always identify itself as being from the Philadelphia MRC. We often communicate new training opportunities, our monthly newsletter, we promote our LinkedIn, and send out surveys on what kind of volunteer opportunities that you might be interested in doing in the future. Next, after you define your volunteer preferences, we will then contact you with what we call a deployment summary if you qualify based on the type of deployment. These summaries usually provide a description of deployments, such as the meeting point, date and shift time, and any other pertinent information to respond effectively to your deployment. In addition, if you choose to accept, there's often a quick link to a survey to select your availability. Next, once you arrive on site, all volunteers are asked to sign both the liability and confidentiality waivers before they volunteer. Luckily, this only has to be done once, and if you would prefer to do it ahead of time, we can definitely do that virtually through email. But if not, we would just have you complete those waivers once you get on site and return it to either myself or Satori, the MRC coordinator, who will most likely be on site. Additionally, after that is completed, we would do an on-site training. So deployed volunteers will receive an on-site training outlining their roles and responsibilities, and this could be in the form of a JIT training or a just-in-time training, which describes the scope of practice and what is expected of you when you are out in the field. So non-licensed, non-medical volunteers cannot perform medical tasks. Licensed medical volunteers must stay within their scope. And if you have any questions on what that looks like, or you are confused or have any concerns, again, you will always have an on-site point of contact, whether that be me or Satori or another Department of Public Health employee or whatever that designated point of contact is that you report directly to. They will be happy to assist you in any way you need. So this is just a visual representation of that deployment summary that I mentioned. And once you have been selected for a deployment, this is what you will receive from the MRC coordinator. Deployment summaries contain really important and essential information and your scope of practice. So I know it might get a little lengthy, but it's really important to read through the fine details so you're fully prepared when you're in the field. Volunteers are only permitted to deploy once they receive this deployment summary. So medical volunteers who are deployed to support the unit act under the license of the medical director for the Philadelphia Department of Public Health, Division of Disease Control. Medical volunteers are permitted to support the department or the City of Philadelphia events with the Philadelphia Fire Department EMS. Requests for volunteer support at these events must be submitted to the MRC volunteer coordinator to be reviewed and then approved by our director at the Department of Public Health. So this is just a visual of our waivers that we will have you sign. Again, all new volunteers are required to sign both of these. And essentially, we just want to make sure that while you're out in the field, we are being respectful and conscious of personal health information. We want to make sure that is kept private while we are treating these individuals. So what is that scope of practice that I keep bringing up? It essentially just means that volunteers should only work within the scope of practice that is communicated to them prior to the deployment and should only operate within the scope of their clinical license. We definitely understand that clinical volunteers have a wide skill set. However, volunteers must follow the SOP as communicated to them in the deployment summary and the JIT training. Volunteers should not go beyond what is tasked. So some of the do's and don'ts of deployment is volunteers are only able to deploy once they receive their deployment summary. We want to make sure that nobody is self-deploying. Volunteers also must email to confirm if they accept a deployment. Ideally, we don't want you to no show, no call. As so if you are feeling ill, you just can't make the deployment anymore, that is no problem. We always want to make sure that you stay home, rest, and definitely notify your MRC coordinator or your point of contact that you will no longer be able to attend. And finally, just again, do not act outside your scope of practice or misrepresent the MRC while you're out in the field. So annual special event deployments. Some of the large-scale events the Philadelphia MRC supports are festivals and runs. So we have the Broad Street Run, we have the Philadelphia Half and Full Marathons, we have the Roots Picnic, we have the Wawa Welcome America Festival, and oftentimes we are supporting in the medical tents along with the Philadelphia Fire Department and supporting them. In addition, we also, like I said, have a first responder flu clinic. MRC volunteers assist with data collection, vaccine assembly, and administration to first responders and their families. And these events are often open to both clinical and non-clinical volunteers. If you are ever unsure of which category you may fall into, you can definitely always email us at mrc@phila.gov, and we can definitely clarify that for you. Since January of this year, MRC volunteers have already saved the city over 30,000 in workforce savings, deployed more than 100 volunteers, hosted 6 trainings, and we are just getting started. And that concludes our 2025 orientation. We have here listed our contact avenues. We have Serve PA, where you can register as a volunteer. We have our phone number and our email. So again, if you have any questions at the conclusion of this presentation, please feel free to reach out. And we have our LinkedIn listed here. We definitely post upcoming volunteer opportunities, training opportunities, and a lot of fun content featuring our volunteers and events. So please follow if you'd like. And with that, thank you for listening. And I hope you have a great rest of your evening and or day. And thank you.